Hey everyone, what is going on? Welcome back to Primetime. This is Dr. Chad Coons. Thanks so much for hopping on your podcast today and following me and listening in. Maybe you're driving around or maybe you're listening during a meeting, whatever it is. Thanks so much for hopping on. And I'm stoked to really open up a big can of worms today, a big topic. I want to help just kind of walk you guys through how you can get back to running a 5K after a knee injury. I particularly really enjoy working with runners. You guys are just wicked motivated. Most of you have something that really drives you, that keeps you just eternally driven and relentless in your approach to continue to run. And I really like that. And that's the type of clientele that I really enjoy. Would you ever see me running a 5K? No, probably not. I think you guys are crazy. But I think it's awesome and I really enjoy working with you. And even though I don't run, for some reason I'm really good at working with runners, so it kind of works out. And not that being said, I can definitely prescribe a hell of a workout program for my runners. But nonetheless, let's kind of get into it. So, all right, so you had a knee injury, and we got to get you back to running a 5K. As always, it should almost start with, what was my knee injury and why? Let's kind of open that up. So there's a lot of different factors. Usually in these type of scenarios, they're not like trauma. It's not like you were at a softball game pitching and you got hit in the knee with a softball or anything like that, or you're riding a bike and you fell down, you landed on your knee. Usually there's something more kind of gradually that's presenting itself. It could be that you run on the same crowned side of the road all the time. It could be that your running form in general is off. We're going to probably open up another Primetime podcast session to talk about that. But let's just leave it right at that for now, superficially. Your form may be off. Hell, maybe you haven't changed your shoes enough and you've been wearing the same god-awful running shoes for the past 6 years and, they've had their point, they're done, and they're causing potentially some pain. Maybe you don't rest enough. Maybe you just simply don't recover enough. I know of those of you who are out there, you guys are running 10Ks, 15Ks, 6 days a week. And not only are you doing it 6 days a week, but you've done that for 3 years. And you come into my office and say, hey, I got this knee injury. I have no idea why it started. And we start to talk about what I clarify as external loading. Well, Nancy, how long have you been running and how far do you run at what pace? Oh, I run whatever, 6 5Ks every day at 6 minute mile for the past 3 years. When's the last time you took a week off? I haven't. Okay. So at some level there's just some micro-traumatic wear and tear that occurs into there. And then we also have to think about the level of asymmetry that running can create. We can't be negligent to that. So in other words, running is very simple in the sense that you only run forwards. So your body will get really good at that. Your body is really good at anything in the sense that it can adapt to that specific level of stimulus called the SAID principle. It'll adapt to any specific stimulus that you give it. It'll get really good at that. So if you only run, and that's the only form of training that you do, you bet your body's gonna get really good at that. And how is it gonna get really good at that? Well, it'll find a way to make its job as easy as possible to run, which sounds nice. Sounds like it would work, but unfortunately the brain's wrong here. For example, most people don't utilize their glutes nearly at all when they're running. I've seen numbers as low as like 7%. So think about that. Your glute max, the biggest muscle in the body, is being used about 7% of the time when you're running. Holy hell, right? I mean, that's pretty crazy. Yeah, with improvements in heel striking and form and ergonomic techniques, we can get that up around 15%. And that doesn't sound like a lot, but if you start to think about the poundage of force and attenuation and strength that the biggest muscle in the body can have, that's pretty extreme, right? So in that sense, your hip flexors can get really tight as a way and as a means of just continuing to run and run and run. And hip flexors can be hell on trying to get your glutes to fire. So is it chicken or egg? I would guess that your hip flexors get really tight and that actually limits your ability to generate force through your extensor profile like your glutes. And then we also have to think about really the opportunity and the idea that your whole body, or at least your whole lower extremity, is conditioned as best as possible to return back to running. So I want to know, guys, if you come into my office with a knee injury and get back to running your 5K, man, I want to know if you've had any injuries along either leg. Because I've seen how, for example, even a right hip flexor injury could cause a left knee injury or vice versa. So we need to be mindful of any injuries on really either side of the leg or your low back. Because to me, that's just a calling card that your body wants to compensate around it. So ankle injuries, ankle sprains back in playing high school or soccer or whatever. Toe injuries can actually be a really significant injury, especially the first big toe. You wouldn't believe how important that first big toe is to get the extension that you need. And with regards to the ankle and foot, you wouldn't believe how important it is for that ankle to have the proper level of arch that's controlled when running. So there's going to be a fair share of you listening to this that are going to have an excessive amount of pronation, or your foot's flat. You're going to have an excessive amount of you that have a high arch. Really, neither is good. We need to help both of you figure out how to come back to a happy medium to have and find and learn and control that you've got a normalized arch, and that you can tap into that and utilize that. So with regards to the knee, most common running injuries that I see is patellofemoral pain syndrome, which can be subclassified into a lot of other different types, which I won't get into. But generally speaking, you can think about the patella, it's not tracking as well as it needs to. Your hip flexor, the rectus femoris, is a key player in that. In fact, it actually attaches to the top part of the pole of your patella, this muscle called the rectus femoris. And because, like we talked earlier, you run, that hip flexor gets tight, it'll actually pull that patella up too far north. You can kind of think of it as out of position. So that's causing a fair share of my runners' pains out there. The treacherous IT band, as I'm sure you've heard if you're listening to this and you're a runner and you've had knee pain, absolutely. Why? We've already kind of mentioned it a little bit. If your glutes never fire, something's got to try to attenuate force and do the work. Don't ask me why the IT band wants to step in and be a superhero, but he or she does, depending on how you want to look at it. And so the IT band gets really tight, but most likely, it's just fascia. It's just really hard fascia. It's not a good candidate, but your body elects for that. So the tight IT band that runs all the way down to the outer side of your knee can actually pull the patella outside or laterally, and that can cause knee pain there too. Those are probably like the two top diagnoses. It's not as common to have like a traumatic injury to the knee, where we're talking like an ACL, PCL, MCL, LCL, or meniscus, due to poor running form, external loading, like we talked about earlier, like you're running, just crazy amounts and you never give up for years and years and years. Yes, you can have, we'll call some level of wear and tear, where the meniscus can get injured or torn. But even then, that wouldn't mean to me that you'd have to go get surgery and be done running. We'd probably have to just find out how to solve your root problem, which is, why can't you rest for a week, once every 10 weeks or 5 months or 6 months or something like that. So in regards to getting back into it, understanding the actual root cause is very important. So root cause is also, just to kind of highlight that. If I'm running on a crown road, and because of that crown road and the same path I take day in, day out, and it causes IT band syndrome, is the IT band the main problem, or is running on a crowned road the main problem? Running on the crowned road. So you've got to really figure out what your root cause is. I wouldn't put that much weight into just bad shoes, for example, but that could kind of be another idea. I've seen it at times where people have changed shoe wear and that alone fixed it, but we want to be investigative. We want to be curious and figure out what actually is my root cause. And it may not be external loading, it could even be the hips or your back or your running form. So we need to investigate all of that. From there, I do think there's a time and a point to doing some level of aquatic training. So for those of you that are, we'll call it our seasoned runners, you guys are in your 40s, 50s, or 60s and above, we're trying to recover from an injury, I like to get you in the pool because it's naturally off-bearing, right? It unloads the joints, the cartilage, the tissue, and you can get some great cardiovascular endurance in there. You might even be able to practice running. If you're near some super fancy equipment, you can even get on a treadmill that helps offload you. So you're working on the striking pattern, you're working on your running form, but you're not having to take the consequence of that weight into it. So as you learn how to run again, essentially, it's gonna be really important to kind of find the best way to teach your body how to do it without, creating a lot of pain. It's also important as you're getting back to running to really tax the cardiopulmonary system in a way that's not load-bearing. So like getting on a bike or even elliptical. I like bike more than elliptical, but something like that, just to help keep up with your cardiovascular endurance, to keep the blood flowing, to keep your psyche in it, to get a good sweat in, can really be important. As well as the idea of and you knew this was coming, I'm sure, a strength and conditioning workout program, told you, needs to happen. So how often, Chad, and what does that need to look like? Well, we could probably spend a whole time on that, but what I will say is at least once a year, I would love to know that you diligently put forth a workout program in an isolated manner, meaning you're only working out for at least 5 weeks. I think that's at the bare minimum. If it were me, I would have, intermittent, interjected workout programs throughout the year, depending on when your competitive season is. But you need to kind of rebalance yourself, right? Because since you're only running forwards, we need to strengthen your extensors, your outer hip muscles, like the abductors, the glutes, the core, and doing some form of even cross training will all be incredibly helpful to help you continue to prevent any recurrent injuries with your knee, all right? So from there on after, making sure that as you progress in your rehab, that everything's making sense to you, you're getting the right form, you're getting the right technique, you're not continuing to irritate the pain, and that you're really learning the overlying reason of why your knee's hurting, okay? And as you transition back into that 5K. Now, as you kind of literally get back to running, I like a little bit of a walk to jog program. So initially getting going, I like to walk 0.1 miles, jog 0.1 miles. Walk 0.1 miles, jog 0.1 miles. And I like to rinse and repeat that. And I personally like my clients to get up to much longer, slower runs than they would competitively before we ever get into sprints or fartlek training, where you are incorporating different types of sprinting and circuit training and different types of kind of accessory running styles. So as you first get running again after your knee injury, I like a little bit of a walk, a little bit of a run. Now, you can progress from that, or you can do no more of just a walk. You can just do a slow jog. I personally like to get my clients even on a track, because they'll start to have some level of circumference running, like they'll kind of run around a circle rather than just forwards. I like a little bit of that dosed into it. And as you progress from there, you can kind of take the same mindset and do 0.1 miles jogging, 0.1 miles a faster run, and kind of seesaw back and forth with that. You can get into a little bit of what I call high intensity aerobic interval training. And that can be really great to help step up your cardiovascular and your cardiopulmonary game, as well as curiously assessing how your knee can handle kind of that next big step. Because ideally, as you get back into running your 5K, you'll have, a couple of days of kind of a longer, slower competitive run, where instead of a 5K, maybe you're actually going for a 10K on those days. You might have a day or two you're doing that high intensity aerobic interval training, where you do some like sprints back into a jog, sprints into a jog, and then you'll have a little bit of kind of a fartlek training where you can do a bit of a combination of all of them for maybe one day too. So that's a really nice kind of way to transition back into your running. but only, and I'm just going to continue to hammer this home, only after we figure out the root cause, why I was injured in the first place, and making sure we're as bulletproof as possible. Recurrent injuries to the leg in general is very high for the runner. And I think it's a lot of times we're not really taking care of the root cause of the problem. There's a lot to analyze. You do have to be patient with yourself as you're working with a practitioner to understand what really happened, what's really going on. I just strongly encourage you to continue to fight the good fight, not give in, and not say, for those of you who are older, well, I'm just not meant to run anymore. My knees are shot. I've just had too much wear and tear. I've been an athlete all myself. I put them through hell. They're just not going to do anymore. I'd strongly encourage most of you to continue to really fight the good fight. There will be a small percentage of you that may eventually run into maybe osteoarthritis, where it's true bone on bone. You've got some grading, and maybe at that point you need a total knee. But I would say for 80% of you or even above, there's probably something that we haven't investigated yet that needs to be cleaned out before you get back to truly running your 5K again. All right, thank you guys so much. I think that's it. Any questions or comments, feel free as always to shoot me an email at chadk@pr1memovement.com. That's chadk@primemovement.com. I was stoked to hop on today. I'm thankful for today. Thanks for listening, and talk to you guys soon. Take care.